Please start.
Please start, Meghna.
Thank you. Good evening, everyone. I would like to extend a very warm welcome to all our esteemed speakers, senior teachers, and guests present today for this virtual webinar, which has become a new normal for all of us. RD National College, one of the oldest college, a part of the Hyderabad Sindh National Collegiate Board, started 70 years back. It was the first college of our board. The Department of Psychology of RD National College, under the patronage of Mukta, has taken the initiative to provide a platform to shed light on how our frontline, hardworking warriors are managing to preserve their psychological capital every single day without fail, fighting the battle of the pandemic COVID-19. We have organized today the one-day international webinar with the topic a focus on the psychological capitals of our hero in the hazmat suit. Not all heroes wear capes. Several years ago in 2005, today being 26 July, was the devastating Mumbai flood, which affected more than 5,000 lives and also had our outlook towards the strength of nature. 15 years later, we are faced with the COVID pandemic, a similar devastating impact on our society. Both the impact has taught us how to physically and mentally deal with our losses of our close ones and better help the others in need. We have dealt with stress, worry of losing our close ones. We have dealt with issues of their testing positive, and we have dealt with it with hard work, resilience. I would like to take this opportunity to welcome four esteemed speakers today. Dr. Avinash D'Souza, a very well-known psychiatrist. The second session will be taken over by Dr. Shashank Joshi, who is an endocrinologist and an active COVID-19 task force member of Mumbai. Third session will be taken by Dr. Malika Shah, an associate professor of pediatrics specializing with neonatal from Chicago, USA. And lastly, we have Dr. Sakhi Bhansali. She's the founder of Curious Cranium, a very well-known organization from Kolkata. Today we have amongst us, besides the four great esteemed panelists, I would like to also extend a very, very warm welcome and thank the team of Mukta under the patronage of Dr. Vaibhav Narvare, Professor Subhash Athavale, and the esteemed team members. Without their ages today, this program would not have been possible. Team Mukta is one of the most supportive organizations I have come across personally. And I am immensely grateful for their support, and I appreciate their efforts to spread this awareness, the plethora of field, even during this unforeseen COVID pandemic. I would like to really, really extend a warm welcome once again. I take this opportunity to invite our in-charge principal, Neha Jatyani, to come and share a few words of enlightenment with us through a short video presentation. Elvin?
Take the first step, even if you can't see the top of the staircase. Believe in yourself, even if no one else does. Hello and welcome to the webinar organized by the Department of Psychology, RD National College, in association with Mukta for Psychological Capital in the COVID frontline war. I take this opportunity to congratulate the Department of Psychology, headed by Dr. Meghna Basu Thakur, and her initiative, and also Mukta for taking this initiative to think of this very topical topic. This topic is very pertinent because it's a big war, these are abnormal circumstances, the new normal is very different, and it's a very trying and difficult time. How then do you maintain your mental balance, your psychology, and this is a very important aspect to be studied and understood. I welcome all the participants, principals, faculty, researchers, PhD scholars, and my dear students for this very pertinent webinar. This year is the 70th year of RD National College and it's the first college of the HSNC board. So I'm sure you're going to learn great insights through this webinar. Thank you for joining us today. All the best, happy learning, and I conclude with the words of Michael Jordan. Teamwork wins games, but talent and intelligence win championships. Thank you for joining us today.
Thank you, Dr. Neha Jagtiani. I would now like to extend a warm welcome to Professor Subhash Atavale from Mumbai University College Teachers Association to formally inaugurate this webinar and share with us the plethora of activities that Mukta is involved during COVID-19. The dais is all yours, sir. Thank you.
Thank you, Dr. Meghna Madam. In fact, this is a pleasure to all of us, the Mukta team. I have with me Dr. Vaibhav Naravde, who is our president, Dr. Manpreet Kaur, then Dr. Sandeep Bhavsar. All of them are here. Dr. Meenakshi is also there. And I'm very much thankful to all of them for joining for this webinar. Mukta, Mumbai University and College Teachers Association is affiliated to Akhil Bharatiya Rashtriya Shaikshik Mahasangh, which is our central body. And we work on the tagline, Rashtra ke hit mein shiksha, shiksha ke hit mein shikshak, shikshak ke hit mein samaj. And to take forward that tagline, since its inception in 2008, Dr. Shekhar Chandratre as a president and Dr. Namdev Mandge as a general secretary started taking immense efforts, and they have laid the foundation of this association. Now, it is in the hands of Dr. Vaibhav Naravde and myself as president and general secretary. And particularly in this pandemic, since the lockdown has started on 24th, 25th of March, our team decided to start something new. We have two cells which are available with us. That is Teachers Education Cell and Teachers Grievance Cell. We also have introduced one more cell, which is Publication Cell. And through all this, we are helping our teachers fraternity for getting knowledge, getting information, and providing training to all of them in different fields of knowledge. Basically, we are involved from 4th of April. We have started this webinar series under the name of Dr. Dattapanta Thengdi. Since then, we have conducted not less than 14 webinars as Mukta, but we have thought of extending the support, extending this platform to the colleges as well, because when colleges will come forward and they will start performing, it will be very useful for them for their NAC activities as well. And taking that into account, we have started extending this facility to the colleges, and this webinar is the outcome of one such activity which we are doing. Mukta is there, very active on Facebook. Mukta is active on Twitter. We have a separate website which has been developed, that is mukta.in. And if you could visit this website, you will be able to see a lot of things which are coming up, a lot of circulars and a lot of activities which you are doing. We are sending letters to university, to the government authorities, and everything we are trying to cover up there. We also have a section of a photo gallery where whatever andolans we have done for the benefit of the teachers, all their photographs are there. It is all association, and all teachers community is extending their support to the association. I am very happy to announce that very soon we'll be coming up with our own learning management system, and which the teachers can take benefit, and they can also develop some courses on it, so that that will give them the credits under the API. I'm also very happy to inform here that we have a YouTube channel, and where not less than 4,500 teachers are subscribed that channel, and whatever program we do, the link has been forwarded to all those subscribers, and they can visit and they can see that program. So in all, thank you, Meghna Madam, for taking up this initiative and involving Mukta also, because we feel pride that we are providing technical assistance and our help to the colleges for leading these activities and reaching out to the people, teachers and students and the stakeholders of the education system. I'm very thank you, Meghna madam. And now, without wasting further time, I would request Anand sir to start with the next proceeding. Over to Anand sir.
Good evening, everybody. Anand Shetty here, and it is a great honor and pride to introduce our illustrious alumni of National College, Dr. Avinash D'Souza, as the first speaker for today's program. Dr. Avinash is a consultant psychiatrist having a practice at Santa Cruz. He is a founder trustee of the D'Souza Foundation. He is a visiting consultant and research associate in the Department of Psychiatry at Lokmanya Tilak Municipal Medical College. He has over 700 publications in national and international journals to his name. So Dr. Avinash D'Souza will be talking about how mental health of the frontline workers is of paramount importance and how it can be improved. He will be shedding light on ways to prevent the deterioration of the mental health of the most important people in the country right now. So I'm very proud of my alumni, Dr. Avinash. Welcome, sir. And you can start the proceedings. Thank you very much. Meghna madam, you can.
Yes, thank you, sir. Thank you, Anand, sir, for the excellent introduction. I am very grateful to you, sir, and I'm sure that the audience and attendees will benefit today from all our four experts. The dais is all yours, Avinash, sir.
Hello, Avinash sir.
Yes. Am I audible?
Yeah.
Yes, sir.
Yeah. Can I begin? I'm sorry, my net was not working properly, so I had to shift location.
Yeah. Yes, sir.
Yeah. Good evening, everyone. And I thank Dr. Meghna Basu, the Department of Psychology, National College, the principal of National College, and of course, Athawale sir and Mukta for having me here. I've been given a very personal topic, and that is on the mental health of frontline COVID warriors. I'm not as big and magnanimous as Dr. Joshi to be on the COVID task force, but I have probably my own meager experiences, which I will share with you all. And my experiences stem primarily from my work with a few of my resident doctors at Sion Hospital, with private doctors in and around the vicinity of where I practice, with a few family physicians in my area, and of course, municipal workers in my area who have been tirelessly working for COVID, to control COVID rather, and that's what I probably will share with all of you. Mental health in India is a very neglected entity. And when I mean neglected entity, not many people like to speak about mental health. Not many people like to say, oh, I'm going to a psychiatrist for a consultation. Not many people like to say, I suffer from depression. Not many people like to say, I suffer from anxiety. So it is something which is not talked about. To give you a very small example of the stigma associated with mental health, which I feel is very important to know, is I have somebody who stays in my lane, 2 buildings away from me. I'm lucky to have my clinic in my house. And when he had to consult me for a psychological problem that his child faced, he asked me whether I practice anywhere else. And I said, you can come to my house and see me. I'm just 2 buildings away from you. And he said, no, the reason I want to see you somewhere else is because if I come to you, people will probably feel that my son is mentally ill and I'm mentally ill, and they will talk about us visiting you. So we would rather visit you somewhere else. So though he's 2 buildings away from me in Santa Cruz, he chose to come to an OPD I have at H.N. Reliance Hospital, all the way Bombay, just to avoid the stigma of being seen that he goes to me. Even amongst doctors, I think what happens is that, we neglect our own mental health. We work day and night. a number of psychiatrists and psychologists neglect their mental health. We work long hours, we work tirelessly, we work with a lot of effort, and we don't take care of our mental health when we have to take care of it. And it's very important that when we're working in psychiatry and psychology and in the current COVID era, that we need to unwind. I remember one of the first things that we did was I work at, I go as a visiting psychiatrist to a few private hospitals, and we spoke to the entire staff and told them that we're with you. And if you need anything, whether you feel low, whether you feel upset, whether you feel anxious, we are here to help you. The same thing we did with all resident doctors at Sion Hospital who are working, because they've been working far more than the senior doctors. The same thing we did with the nursing staff at Sion Hospital. And the reason this was very, very important is because we told them, if you need any help, we are available. And there are friends of mine who have been dealing with COVID patients. They've been running their own nursing homes. They've been running their own private hospitals, which is partly in tandem with BMC, partly their own. And they say there are long hours of work. We are seeing a lot of death. We are seeing a lot of grief. We are feeling helpless at times that we are unable to do anything. And we feel upset. We feel affected. We feel hurt. We feel a lot troubled. And we don't know where to go. So they phone, they just talk to me. They say, even talking to you for half an hour or 15-20 minutes helps. And one of the main things I would want to convey to everyone here is that mental health is vital. So whether you are a frontline COVID worker or not, mental health is vital. So please be open to speak about it. Please be open to visit someone when you feel the need. The lockdown can get to you. The pandemic situation can get to you. You can feel dull, monotonous, hopeless, helpless, worthless. And when all these things come in, please seek help from a professional. We've also been part of there are many other psychiatrists apart from me who've been part of a helpline, which is a free helpline. And we have received a number of calls from health workers on that helpline. We've received a number of calls from medical students on that helpline. And these are calls that, sir, we've always been working 14, 16 hours a day. It's never been a problem. But what has been happening now is that we are seeing a lot of deaths. Every day we are declaring to around 10 relatives that, your patient is no more. The relatives get upset. We also get upset because we feel helpless as a doctor that we're unable to do anything. At the same time, we have very little time for ourselves. We have very little time for our family. Our families also complain that we're not in touch with them. We also have some of them are in love relationships, and their girlfriends and boyfriends who are probably non-medical complain that they're not in touch with them. And they say that they don't understand that what we're doing is a service to the nation and to people. And that also gets to us when our own family fails to understand what we're doing. Many a times it also happens that I've had initially, I remember I had a call from few dentists who were upset because they had just started their clinics and COVID forced them to shut their clinics, and dentists did not start practice till recently with guidelines from the Indian Dental Association. So they were a little upset that we've started a clinic and now we're not going to it, and everything is lying there and nothing is happening, and it's been 2 months, 3 months that we aren't going. So except maybe in very acutely emergency cases, but they were not going. So this was something that has also come up. A number of nursing staff and as it is, the medical fraternity and the nursing staff are stressed. A lot of them have blood pressure, a lot of them have diabetes, a lot of them have obesity, a lot of them have other medical problems. And they are more susceptible to COVID, courtesy these problems. Yet they have been working tirelessly day in and day out. They've been taking all the precautions. They've been doing all that they need to do. And the important thing is doctors need to speak to each other. It's very important that you have your own small groups of friends, of people who you speak to, discuss, debate, and talk about various things. It's very important that you have your own small groups of people with whom you can probably discuss about mental health, which isn't done. Some years back, WHO had their theme as Depression, Let's Talk, because no one talks about depression, no one talks about burnout, no one talks about the feeling that you are doing the same work and it's getting monotonous. No one talks about all that. So it's very important that you speak about these things. It's very important that you discuss these things, and it's very important that one should probably learn to handle these things. And I think hospitals neglect the mental health care of their doctors, which is important. And I think doctors need a space to vent out, speak, particularly in this COVID scenario when there's so much of stress around. There are times when doctors have been busy with COVID patients and have not had time for their own family members who suffer from COVID. There have been times when doctors have lost a loved one to COVID, but have not had the time to grieve because they are busy with COVID duty. So that's the kind of impact on mental health that this pandemic has had. And the pandemic has been an unprecedented situation. I don't think any one of us has ever expected that this pandemic would take these proportions. And as a psychiatrist, now what I am seeing is the emergence of the second pandemic, which is the mental health pandemic that we're seeing. The economic recession, the loss of job, the unemployment, the family problems. We've seen a surge in cases of domestic violence. We've seen a surge in cases of aggression, alcohol use. So all that is happening. We've seen a number of young doctors who feel that they've been pushed to the brink of breaking down because they've been working, they've been overworking, and there's no rest. There have been physicians who felt helpless because of patient deaths. There have been certain specialities who felt they're all doing their bit, but particularly the physicians are on the forefront. The surgical specialities are also on the forefront. The respiratory medicine people are on the forefront. All other medical specialities are on the forefront. So many a times people have felt that yes, they're all doing their bit, but it's difficult. I know I did. There's also been a certain amount of uncertainty amongst the postgraduate medical students because their exams have been postponed, and probably for the first time they may have their exams online. MD exams for some specialities have been held online, and they probably will be held online for some specialities. So that's another thing that is worrying them, that they are doing COVID duty and they probably don't have enough time to prepare for their exams. They have been recently relieved so that they do get time to prepare for their exams, but that's also something which is bothersome. Uh, there is an intern batch that is unsure about postgraduate entrances, postgraduate admissions. So, and they're also working in the front line to deal with these patients and to deal with the scenario that we are all facing. And that is something which I think is breakdown. And I've had a session with interns of Sion Hospital, and
Avinash sir's audio is lost. Yeah,
yeah. Am I?
yeah. But your audio is not coming. Sir, your audio is not clear here.
Avinash, we are not able to hear you. There's some challenge with the audio.
There's net issue, I think. Avinash, sir?
We cannot hear him.
Yeah, I think there's some net issue at his place.
At his place.
Yeah.
Well,
Because
without
from our
earphone, I
side,
think.
pardon?
Madam, without earphone, I think he can speak.
Yeah, but right now he has lost his connection only.
Yes, he's lost his connection.
Yes, come again. Let us see. Otherwise,
He said he's just trying his connectivity once again. He's changed his place.
He has come, but then connectivity is not connecting his audio. Yeah, now I think he's okay. Yes, Avinash, sir?
Hello.
Avinash, sir? Avinash, sir, your audio, I think you can plug out the cable and you can start through laptop only. Okay. Meghna madam, yeah, Avinash sir has sent the message. You can start with the next speaker, and as soon as the connection, yeah.
Yes. So someone will be welcoming Shashank sir.
Yeah. Megha madam. I'll request Megha madam to introduce Shashank sir, and then we'll go ahead.
Yeah, thanks, Subhash sir. People pay the doctor for their trouble, but always remain in debt for their kindness. We have with us our next speaker, Dr. Shashank Joshi, an endocrinologist from COVID-19 Task Force. Professor Joshi is president of the Indian Academy of Diabetes and Endocrine Society of India. He is immediate past president of API, Association of Physicians of India, and past president of RSSDI, that is Research Society for Study of Diabetes in India. He is visiting faculty of several Indian and international universities. He is actively involved in evidence-based work in endocrinology, diabetes, obesity, thyroid, osteoporosis, and growth. He was awarded International Clinician of Year 2012 by American College of Endocrinology. He conferred Padma Shri, I repeat, Padma Shri, in 2014 by Government of India. He is fellow of American College of Endocrinology, American College of Physician, Royal College of Physician, London, Glasgow, and Edinburgh. He has more than 600 papers, research papers to his credit. As Amitabh Bachchan rightly said, we do not see God here on earth, but he has sent his nominee in white coats to us, doctors to us. I again say that medicine only can cure the disease, but doctors cures the patient. I am and we all are here very much eager to hear now the first-hand experience of Dr. Joshi with COVID-19 and how he has managed to remain so optimistic regardless of the situation. Most welcome, Dr. Joshi here. We welcome you on this platform.
Thank you for your kind words of introduction. And I must thank Dr. Meghna Basu Thakur for being persistent. And she was deliberate and persistent that I must speak here. And I am a little sad that in these unusual times, my good friend Avinash lost his connectivity. It can be very challenging at times because this connectivity is the only way we can be virtually connected. So this COVID is only an 8-month-old virus, and it has virtually, halted planet Earth. And there are 4 or 5 things I want to tell you about the virus, and my link with the virus, and where are we, what are the unusual nature. Fortunately, Avinash will connect, but probably I'll finish my talk and probably then he will give his pearls of wisdom. So this virus, was not known before, 2019 end 31st of December. It's a very small microbe. It's a RNA virus. It looks very innocent, like a common cold, but it's predictably unpredictable. So the first take-home message is, or stay-home message is, it's a predictably unpredictable virus. In someone like any one of you, it might stay in your body, and 80% of the time, nothing is going to happen. You may not even know that you have got this virus, and you'll be fine. And after a few days, somebody might do an antibody test and you'll be positive. In another 15% of you all, you will have the virus. You might get some symptoms, mild, moderate. You might visit a doctor, take some medicines, and you'll be okay. And maybe a 5% of cases might land up in a hospital, get critical. We may lose that person, and some people will survive. So this is the first thing about this virus: predictably unpredictable. And who are the most vulnerable groups when somebody is going to get COVID? It is the senior citizens above 50, 55, and the people who have hypertension, diabetes, and so on and so forth. They are the vulnerable groups. The other thing this virus has sprung up is a degree of uncertainty. We are living in uncertain times. It's an unknown virus. It is unusual in its nature. It is very unproven in its mechanism of working. Sometimes it affects the lung, sometimes the heart, sometimes the kidney, sometimes the liver, sometimes it causes diabetes, sometimes it affects the brain. So it's in an unproven time. And as I said, it's uncertain and unpredictable. So that's the other thing. And when so much is there, we need good communication, good care, and good control on all this. So as Megha said that I'm an optimist, and I always will remain an optimist. I had some public health experience when I was doing my internal medicine, because I was very closely involved with the HIV/AIDS pandemic. And those experiences of HIV/AIDS, and then I moved into endocrinology, and COVID got me back into my old public health and infectious disease days. That time HIV/AIDS had a lot of stigma. Even today, when I say the word AIDS, there is so much of stigma involved in it. That stigmatization was very huge. Probably in the good old days, leprosy had the same stigma. Similarly, COVID started with a stigma, and that stigma has got stuck with us, and that is something which we need to get away with. It's just a flu. Any one of us can get it, and I don't think we should get stigmatized about it. Most of us are going to get done with it. The other thing which COVID has is, you can't be complacent, you can't be foolhardy, it's going to be there. So whatever you may do, it may still hit you. But care, caution is important. And today we live in a Googleized WhatsApp environment. This way we are talking today on a Zoom. It's very unusual because this gives you a platform to do what you like. You can just mute your mic, you can hide your video, and get back on our gadget. And we are having a tremendous sensory overload. And this sensory overload actually has caused a huge mental anguish, which Avinash was alluding to. Because what has happened is that we have information overload, and that information overload has a lot of negativity with it. And very rarely I will see on media, our WhatsApp university, on Google, positive stories coming out. People engaging. I don't know how many of you all know, but there are so many free university courses right from Harvard, Yale, you can do online, which are free. Every museum on planet Earth is available for you to see. And there are so many musical classes you can take. You can engage in all the hobbies virtually. But I think we are all stuck to an idiot box. We are all stuck to what comes next from your best friend on WhatsApp. And we are all stuck to, information related to COVID. And therefore, this COVID phobia, COVID anxiety, COVID, panic has become the order of the day. So I think the virus in the mind is actually causing more harm than the virus in the body. The virus in the body is very manageable. If you ask me, 99% of the time, if you are alert and vigilant, you can manage the virus in the body. But the virus in the mind is like a ghost, and it has conquered our mind, and it's very difficult to beat. So I'm going to give you only 2-3 tips on the science and the biology of the virus. You see, when the virus starts, it comes in the nose. So there is a nose COVID. Most of the nose COVID is very easy to manage. You need good nasal hygiene. If you are an alternative medicine believer, you can do, these simple things on nasal cleansing mechanisms, and you are good. Then you have the throat COVID. You do a lot of gargles, do steam inhalation, and that is the time you should get alert, because the lack of taste, lack of smell could be the first symptoms beyond fever or breathlessness of COVID. So that throat COVID gets you into an alert mode, and probably should do a test and go to a doctor. Then comes the lung COVID. Lung COVID is also okay. You can do with it at home also most of the time, but if your oxygen is normal. So the new thermometer in COVID is actually the pulse oximeter, and we had to measure oxygen all the time. And if the oxygen requirement goes up, you see, COVID is causing a flood or oxygenation. Madam was alluding, today is 26th of July. It's 15 years down the line that we are getting an oxygen debt in our lungs. And if our lungs are crying for oxygen, and you are desaturating after you do a good 6-minute walk test, if your saturation is less than 3%, then you are into trouble. Then you should contact a doctor and get into hospital. Now, there are a couple of things which you need to understand. That if you have to go to hospital, then you need to go into hospital, surrender to your doctors, they will take care of you. And most of the people will do very well, because most people who will go to hospital will get some treatment and they will come back. We have some very good treatments now. Any part of the world, probably we are more fortunate. Even in the US, sometimes RT-PCR test takes 3 days and 5 days. Mumbai is the unique city in the world where every test is now available without a prescription of a doctor. Without a doctor's prescription, you can do a COVID RT-PCR test, best done between 5th and 10th day, and you can go to any lab. It is free from the BMC, and usually it is positive in 70%. So 30% may have the disease, but they don't know that they have the disease because the test is negative. Then we have the antigen test. 50% of the time it is positive. And antibodies we normally don't do, but these tests are available off the shelf. You don't need any specialized things. Even if you go to a country like US, you need 3 days to get the results. So we get the results immediately. In fact, the antigen test result time is only 45 minutes. You will have the report. So if people get, every person has this anxiety. Will it happen to me? And most of the time it won't happen to you. If you follow strict hygiene quotient. See, we have a very good emotion and intelligence quotient. I think India leads the world, because I think we have extra omega-3 fatty acids. So we are argumentative Indians. For everything, Indian brains are so acutely sharp that they think that they have a solution for everything, So we are, mini encyclopedias inside our own brain. I think we have two brains in our body. Like Shiva has a third eye. We have an extra sensory perception that we know everything. We are like a know-all people. So, COVID is little smarter than us. So don't be so complacent with COVID, because before it knows, it will take over your mind. And secondly, we are very anxious. So that anxiety kills you more by releasing negative chemicals. So I think, you need to tackle COVID with a lot of care and caution. So our biggest problem is our emotional quotient is very poor. And I'm sure you have other experts who are going to talk about emotions. I'm sure, we need to build a strong resilience. But I think what we are poor in is our nutritional habits are very poor, and our lifestyle habits are very poor, and we have one of the worst hygiene quotients. And despite of having such a bad hygiene quotient, we have done very well with COVID. Just yesterday, I had the fortune of interviewing the Mumbai Municipal Commissioner, and he said that the COVID came imported from abroad, and then it was with all the elite of Mumbai. From there, it went to their drivers and maids and went to the slums. And from the slums, now it is with the Aam Aadmi or the common man. And now it is in all the high rises. The urban slum of Mumbai and any high rise of Mumbai are all the same in terms of the slum or the engineering. And they are virtually going to have the same risk of transmission if you don't follow a simple SMS guideline. You need stick soap or sanitization. You need to mask, completely mask. We can't be as stupid as the US Americans are. They are the worst country affected on planet Earth today. And God bless them. And their numbers still are ticking very fast. And we are world number 3 already. But in 1.3 billion people, we still are, and we are past the peak. Remember, Mumbai is past the peak. We were 21 days in the peak. From 15th of May to 10th of June, we were in the peak. But now we are past the peak, but we want to stay in the peak. We don't want a second peak to come up and hit us. So our hygiene quotient still needs to be very high. We need to mask 24/7. And a lot of people ask me which is the right mask. The best way to have the right mask is take a candle in front of you and put on the mask, covering your nose right up to here, and try to blow that candle. If you can't blow that candle out, it means that your mask is appropriate. You don't need all those high technology stuff. We need to do simple things. So mask. Masking is mandatory. Sanitization and washing your hands with soap and water is mandatory. And distancing may not be possible. Other thing is we need to open our windows because we need to have exhaust. Remember, these crowded environments, it is microdroplet airborne transmission, which we now very clearly know. And Mumbai is a perfect recipe because we generate a lot of aerosols in monsoons. And monsoon is going to be a big time for pandemics to spread. So we need to be very cautious and careful. We have to unlock. We have to get back our economy back, our livelihood back. But we need to do it very mindfully because now, that's what is happening. The other thing which we need to know about COVID is that our healthcare workers are all doing their best jobs. They are right there. You have enough beds in the city. Don't have the anxiety whether I'll get the bed. We have a 1917 helpline. There are vacant beds and there are walk-in facilities. For example, if you fear that I have got COVID and I don't have a bed in Lilavati Bhaba or Holy Family Hospital or any hospital, just go to one of the jumbo facilities and check in. It's an open check-in. There is no fee asked. Just go and walk in. You have more than, from every part, whether it's a dome at Worli, whether it's MMRDA complex, whether it's Nesco or Mulund, you can just walking those 5,000-6,000 beds. Nobody's using them. And there are very good ICU facilities. There are professionally trained doctors there. There are oxygen facilities because COVID management is all about getting the oxygen at the right time and lying in a prone position, doing some pranayam, being cheerful and positive, and having a mindset to handle the COVID. So it's all there. I think the healthcare workers are doing their best, but I think our police force, our sanitization workers, and each one of you are, according to me, COVID warriors, because I think you need to motivate and send the right information. Unfortunately, as I said, because there is so much of information overload, and because we are the best brains in the world, every person has a COVID, COVID medicine and a COVID protocol. So, if I ask each one of you have your own thoughts. So there are very good medicines for COVID, but most treatment of COVID is supportive. Okay, we can give some vitamin C, D, and zinc. We can do a lot of steam inhalation. We can give early medicines, like we have this oral antiviral like favipiravir. Lately, we have remdesivir. We have these novel monoclonal antibodies. We have this plasma, oxygen. All these are very good. And we have alternative medicine. A lot of people don't believe. They think, everything we do in allopathy is having huge amount of side effects. We have these doubting Thomases all over. And a lot of people ask me, can I take homeopathy? Like in Genus Epidemicus, they recommend arsenic album or camphor. If you want to take homeopathy, go to a homeopath. But I don't recommend it because, that's not my subject specialty or domain. But I don't want to argue, with somebody. Can I do Ayurvedic treatment? Well, Ayurveda has ashwagandha. They have so many of these vatis. But they have a lot of philosophy which is good for good hygiene. For example, in Ayurveda, if you have sattvic diet, if you clean your nose, you clean your throat, and do good pranayama, it itself will take care of a lot of COVID if you get COVID. So some of these habits of our ancestors, of our forefathers, may be very useful. The most important thing is the Indian tradition of no-touch technique. See, if you look at all our Indian habits are no-touch technique. Right now, though, we are not even meeting physically, we are meeting virtually. And that's so lovely. But I think that no-touch technique itself is something very positive. I think my only couple of last take-home points are that COVID is going to stay for a while. We have mitigated to the problem to a great extent. We have to be mindful of the second peak. We will get a vaccine, but the vaccine is probably somewhere in April, May next year. We wish it comes by Jan, Feb next year, but I think it will not be before April, May that we will have a vaccine for COVID. But in the meanwhile, you need to self-protect. So, what our Prime Minister said, Atmanirbhar, or, we need to self-protect. It's all about self-protection, self-love, self-care. If you take care of yourself first, it is like when you sit in an aircraft, an oxygen mask comes down, Similarly, when you sit in the aircraft, you are sitting in your own seat of life. You have to take care of yourself first, and then you take care of your family members. And tell each family member of yours that you have to self-protect because you can get the virus from outside. So you need to be sensible. Unfortunately, coronavirus has never made us, the sense of smell or taste may go with coronavirus. But we have started losing our common sense by having these acute panic syndromes. And I think that's very, very important for all of us to recognize that it's time that we need to live with a lot of positivity and smile with corona. Most people won't get corona. Most people who will get corona will have very mild disease and they will overcome it. It will be asymptomatic. As it is, our Indian immune system is pretty robust. Our T-cell responses, what we do in research, has shown very good data to show that we have done, most of our patients have done very well. They have unusual symptoms. And even if you get it and you get moderate to severe disease, we have a unique city where we have empty beds, including ICU beds, which are available free of cost to us, where we can access them. It is not a mandatory thing that you have to rush to a large private setup where you might have to spend a lot of money. And we have every drug available on planet Earth available with us. For example, if you want remdesivir, we have stockpiles of remdesivir. You need oxygen, you need high flow nasal cannulas, you need ventilators. They are all available in the city today. We have surplus of them. In fact, we have a surplus of inventory. You need these monoclonal antibodies now. They are all available. Maybe a couple of weeks back, when we were at the peak, we had a lot of acute shortage because these drugs were not available. We have the largest plasma trial in the world happening in Mumbai and Maharashtra. And we have a large repository of the covalescent plasma available with us. So remember, there's a lot of hope and we need to spread the right message and the right information. I think all our healthcare workers are doing a yeoman's job. Our current target is to save lives. Every human life matters. And we want to get into a below 1% mortality rate. And we probably want to get into a zero corona mortality rate. That's our aim and mission. And I hope that all of you all are teachers. We respect our teachers after our parents. So I'm sure that you will be our corona messengers, telling the right information to all your students, to all your family members. And I wish and pray that all of you all stay safe and stay self-protect. Please love your own self also. Please don't abuse yourself. Please sleep for a good 8 hours. Please eat on time and eat slowly. Please ensure that you do 2 hours of digital detox every day. All these screens which you see here, okay, or your mobile phones or your televisions, they will lead to bad eyesight. They will damage your retina. With Professor Natarajan, who's a leading ophthalmologist of the city, I am doing research on a WhatsApp vision syndrome. You will get macular degeneration and retinal degeneration if you do not do appropriate, if you are totally intoxicated by all these gadgets. Remember, this gadget addiction and food addiction is much worse than any drug addiction. And therefore, it's very important that we get de-addicted from all these devices. So please do a digital detox and get out of this corophobia or corona anxiety. Don't get coronized at all. I think that's a bad habit. Please stay away from tobacco, alcohol. Please ensure that you do sensible, commonsensical things. So I think I'll stop here. I'll be more than happy to answer questions later on if there is a panel discussion, because I'm sure that there are many more worthy speakers than me to speak on this topic. So thank you for giving me an opportunity to be with you all. Thank you very much. Jai Hind.
Thank you, sir. Over to you, Megha ma'am.
Thanks a lot, sir. Many, many thanks to you for a brief and minute, minuscule and micro telling in a common man language. I'm very much pleased to join you here today, and we all are very much pleased to join you. It's our, actually God has given us blessing to listen to you today, sir. Thanks a lot. Now it's over to Subhash sir now.
Thank you, Meghna Madam, for taking over. Now I request Meghna Madam to continue with the next speaker.
So with Avinash sir be joining now, or would he be joining at the end?
Avinash sir is there already. Avinash sir is there already.
Avinash sir, would you be joining now? Hello?
I think his audio is mute. Yeah, we can go ahead with our session.
So thank you very much, Shashank sir, Dr. Shashank. That was a very enlightening talk. I would like to now invite the third speaker for the evening, Dr. Malika Shah. Dr. Malika is the medical director of the Northwestern Newborn Nursery at Prentice Hospital, Women's Hospital, Northwestern Medicine, and is an attending neonatologist in the NICU at the Ann Robert H. Children's Hospital of Chicago and Prentice Women's Hospital, USA. She has completed her graduation from Stanford University and also has a board certification for neonatal prenatal medicine from the American Board of Pediatrics. Dr. Malika Shah would be talking about the psychological stress of COVID-19 pandemic on new families, pregnant mothers, just delivered mothers, and the impact on newborn babies. These families are already struggling with their new lives, especially mothers, on top of which the pressure on their mental and physical well-being due to the virus with an exaggerated problem. Dr. Shah will also be providing them with solutions and effective measures that they can take to overcome the stress. I welcome Dr. Malika Shah. The dais is all yours, ma'am. I think, Malika, you will have to unmute yourself.
Please unmute, madam.
Okay. All right. Can you hear me?
Yes. Yes.
All right. Terrific. Hello, everybody from Chicago. It is 7:30 in the morning here, and I think everybody is all over the world. So whatever time zone you're in, thank you for joining. I'm absolutely thrilled to be here. It's really my great honor and privilege to talk to all of you about something that I absolutely love doing. Getting to see a new baby born in the world, whether they're sick or whether they're healthy, is generally a really joyous occasion. Whenever a baby is born and they're completely healthy, nothing could be better. And when they're not healthy, as a neonatologist, what I do is take care of premature babies with ICU medicine, using ventilators and oxygen and all all of those kinds of things. And I'm very fortunate and very blessed to have all those things available to me. So taking care of a premature baby is generally, something that I also really enjoy getting to do. COVID is really throwing a wrench into everything. It is an absolutely unprecedented time in everybody's life. I have been practicing now since 2002, so for almost 20 years, and it's the first time that I have ever been part of something that affects everyone globally in the way that COVID does. I think one of the biggest things that you have to realize is that pregnancy, even without COVID, is a unique time in every family's life. Wherever you live in the world, when you are pregnant, it's almost always something you haven't experienced before. Of course, you could be, it could be your second pregnancy, it could be your third pregnancy, but the addition of a new family member is always just that. It's the addition of a new family member. It's new. You haven't gone through it before. And so for that reason, every family has, a lot of different things that they do to adjust to this that are affected by COVID. I don't think that I think that one of the biggest things is that when you look at COVID, I'm going to kind of focus on India a little bit because, as you can tell, I'm from Indian origin as well. But there's a phrase that we use, which is it takes a village. And when we talk about saying it takes a village to raise a child, I don't think it's true anywhere more than it is in India. In India, there's so many cultural nuances, so many things that families do to assist a new mother. And I think one of the things that I remember the most is sort of the custom of at around 7 months going to your mother's house from the home that you live in, whether it's with your husband and his family or whether it's just with your husband or your partner, you end up going to your mom's house. Well, in COVID times, that sort of practice may not be able to happen because you might live in a building where it's not allowed for you to do that. Or even if you're able to do that, your husband wouldn't be able to go back and forth. And so that is something I think that can be really, really isolating for fathers. And I have the great privilege of working at Northwestern, where there is tons of research on new families. And I don't think this is said enough, but fathers also go through a lot of biological changes. My esteemed colleague, Dr. Craig Garfield, does a lot of work in this, but men also, when a woman's going through pregnancy and when they have a new baby, they have testosterone changes, they have cortisol changes, they have a lot of changes in major hormones. And so all of this is kind of, to some degree, getting disrupted for the father and potentially for the mother as well. And this is a family that doesn't even have COVID. This is just living in the COVID era. If you actually have coronavirus while you're pregnant, you are faced with an enormous amount of uncertainty. At Northwestern Memorial Hospital, we have treated I think we're up to 80 women now who have had COVID during pregnancy. In the very beginning, April and May, the women were very, very sick. In our city, we had a couple of women that died. And they'd not even had an opportunity to see their newborn. Now, I think we're picking up a lot of women who, as the previous speaker so candidly spoke, that who were absolutely fine with COVID, and they probably had it sometime earlier in March or in April. Because we have a policy to universally test every single person that comes into the hospital, I think we're picking up some people that actually have an old recovered infection, and they've done very well with it. The question for us is, what do we do as healthcare providers? Obviously, we will take the protection we need to with face masks and face shields and PPE for the delivery. But how do we treat this mother-infant dyad? We have changed already 3 times. So in the very beginning, we were separating these moms and babies. And I really feel like in March and April, I think that made a lot of sense because the moms were almost always very sick. And to leave a mom in a room with a baby, when she is sick herself, A, the baby could get the infection, and B, she needs to rest and recover. So we were taking these babies away. Well, we continued doing that. And what we found was over time, we were getting less and less of these women that were even sick. In fact, I would say probably the last 10 to 15 women that we've had, they didn't even know they had the infection. They came in to deliver the baby, because they were in labor, and they were found on a universal screening test to just have coronavirus. So one, I think that is, the previous speaker just talked a lot about being optimistic. I think that gives you a lot of reason to be optimistic that these are women that had it. They didn't even know they had it. They were absolutely asymptomatic. And that's a good thing, because that gives me hope for people getting it. But it didn't feel very correct to take their babies away from them and quarantine the babies and quarantine the moms. So we just this week rolled out a new algorithm by which the baby can stay in the room with the mom. But there's a lot of challenges with that because you have a mom who's positive. So do you allow her partner or her husband or a support person to come be with her? Well, what if they get it from her and they didn't already have it? Or what if they already have it and now you're bringing this person into the hospital? The mom is a patient. You can, in our institution, you can kind of control where she is because she is a patient. So you can say you can't go, to the second floor, you can't go to the lobby, you can't go anywhere because you're a patient. We will transport you everywhere. But for visitors, we're not able to do that as easily. We have some pretty robust visitor restrictions, but we do allow most pregnant women at least one person. For coronavirus, though, that's different. We don't. So if you have coronavirus, if you are COVID-19 positive, you will deliver alone and you will be in that room alone. So that is incredibly isolating. It's not the way any woman pictures having a baby. Obviously the nursing staff and the physicians are there, but nobody else is there. You don't have a mother or a husband or a partner of any sort, a friend, anyone to be there with you. And then afterwards, in that immediate recovery period, you are only with your nurses and your doctors. I think this places an extraordinary burden on nurses in general because they are really kind human people, and they can, a lot of them, most of them, I would say, are mothers themselves, and they want nothing more than to just take care of you, and they can sense that loneliness and isolation. And because of that, they take care of these moms postpartum with their babies in a really, really profound and complete way. So I think that's something, I really want to give a shout out to all of the nurses that I work with because they are the primary recovery people for these moms. For the moms, it's definitely isolating. And I'm going to go at the end just into a few strategies for things I think that can mitigate it. So that we've kind of gone through the women that are delivering that don't have COVID and how isolating the period is antenatally, and then during the delivery time period, how isolating it is for women. For women who don't have COVID, we only allow one visitor, just the, usually it's the father or of the baby. But that's, I think it's one thing I do want to say about the incredible loneliness is having these visitor restrictions, it has actually interestingly a really positive effect on breastfeeding. I think previously, it's just one little piece of, one little silver lining. Women who, deliver at our hospital and probably all around the world, sometimes there's a lot of eager anticipation. I think it's perhaps no more true in Indian families. You just have so many brothers and sisters and cousins and your in-laws and, your in-laws' siblings, and everyone is just eagerly anticipating the birth of this baby, that sometimes when you have the baby, that immediate period, if there's a lot of visitation, can actually be really hard for the mom to get rest and for the mom to be able to feed the babies on demand, whenever the baby's hungry, because you are entertaining guests. I think that has been one thing that has been really, really nice for new families, that just having a little bit of taking a pause on that visitation and just having the one support person, it kind of allows that family to just be the three of them for a little period of time, which I think actually as difficult and isolating and lonely as it can be, it does have some advantages. So that's one thing that I want to talk about. Some of the strategies that we've employed in the hospital to just keep people connected are really leveraging technology. And we are really blessed and well aware that we're in the United States, which is not doing at all a good job from a sort of national perspective, but from local perspectives, local governments. I live in Illinois, we definitely have a mask mandate, and our hospital has very strict protocols. Every day that I come in, my temperature is checked, and I'm asked a series of questions. I'm obviously expected to mask. I also get my serum checked for antibodies every so often, and I can get a COVID test whenever I need one. So I'm really, really, really lucky and fortunate in that way. I'm also really fortunate that for our patients, we absolutely have iPads, and we have these access to various other modalities of technological things where people can stay in touch digitally and technologically. So all of the rooms do have phones. We're able to get iPads into the rooms for the COVID patients, and certainly able to use the phone. Most of them have enough resources to have cell phones themselves. So they're also able to do that. And some of the other things that we're able to do in addition to video monitors, we're able to have some music therapy, and I think that can be really, really, really helpful. We also have our nurses for the COVID patients. We're really, really lucky because I don't think this is something that most hospitals are able to do, but we are able to have at the current time one nurse just for that patient and for that patient's baby. So I think that can definitely be really, really helpful too. If a mom and a baby is separated, we are also able to endorse like hand expression for breast milk and using breast pumps. So those things I think are really, really, really important. I will say one thing, that as much as we try to do all those things, I don't think that we can ignore the very, very true reality, which is that these women are, lonely and isolated, and there's very little that we can do, I think, we can't just say that like we've given you an iPad and that's going to sort of take away all the pain of being isolated or not getting to have, the father of the baby be at the delivery or even come to the hospital. I think to some degree, sometimes you just have to admit it and acknowledge it for what it is. You can't fix some of this. You can be kind and you can be compassionate. You can say this has got to be so hard for you, but you can't minimize it. It is a really, really big deal to deliver alone. And it is a really, really big deal to have, your support person, your husband or your mother or whoever it is, or whoever it was going to be, not be able to come to the hospital at all. I think some of the previous speakers have mentioned resilience. I will tell you that the women that we have treated have been so resilient for their babies and for themselves. It is absolutely heartbreaking to see some of these stories. I'm going to talk a little bit about just after going home, and then I'm just going to kind of tell you one story of resilience that I have that I was so impressed by. So after discharge, being a new family and going home, and this is even if you don't have COVID, the access to care is very different now with telemedicine. A lot of women are not going back to the doctor's office for a postpartum check. They are doing that by telemedicine. For the babies, that's not possible because babies do need to be weighed and they do need to be examined. And so some of the strategies that pediatrician offices have used has just been, you don't have a waiting room. You wait in your car or you wait outside until it's time to come in. And I think that has a psychological effect because you're just isolated until the very last moment, you know. Previously, you'd be in the waiting room, you'd meet other mothers. We have a lot of informational stuff that's in waiting rooms in pediatricians' offices. You might pick up a handout on postpartum depression. You might pick up a handout on, you know, who to call if you just want someone to talk to. We have all these state resources, all these places where people can get support, and you don't get to see any of that, you know. So we forget these little things, like how just being in a waiting room as a new mother can make you feel a little less isolated. You see other mothers there. You might see a mother with a toddler screaming or misbehaving, and it just makes you feel, you know, like you're part of something bigger. This sort of new journey into motherhood is something that other people are facing to, other people are struggling to. Now you are waiting in your car or waiting outside with just you and your baby. And when you're finally let in, oh, it's your turn, you go right into the room, you meet the doctor, and you leave. So I think, you know, I'm not a psychiatrist and I'm not a psychologist, and I'm really privileged to, you know, know people that are, but these transition points are really important and we are eliminating them. So I don't know that there's an answer to that, but I think acknowledging it is a good first step. And the last thing that I, you know, wanted to just talk about was just an enormous story of strength. So it was actually our very first case where the mom was COVID positive. The reason that we knew was because her husband, the father of the baby, was very, very sick. He was intubated, you know, so on a ventilator in the intensive care unit at our partner hospital, which is connected to our hospital, but it's the adult side. And she came in and she had had a fever. So we tested her. At that time, our tests were taking over a day, even 2 days to come back. So we had her tested while she was in labor. And the baby was actually born before her test was back. But we immediately, so right when the baby right when that baby comes out, the baby is immediately, right after the umbilical cord is clamped, the baby is dried off. And at that time, our practice was to take the baby away. And so we immediately moved the baby to a nursery, to the care of a nurse who took care of the little one. And the mom is now in the room. She has a fever herself. She is having a little bit of difficulty breathing, and her dear husband is in the intensive care unit across the way, you know, which is across the street from us, on a ventilator. She doesn't know if he's going to get better. She can't see her baby, and she can't have a visitor. You know, this virus, which I know has been said before, and I'll say it again, it doesn't discriminate whether you're rich or poor, but you know what? It kind of does too, because if you're resource poor, maybe you don't know the language of the hospital that you're in. Maybe you don't speak English. This woman did not, you know, so the virus doesn't discriminate, but then in a way it kind of does, you know. So this woman was Spanish speaking only, so she didn't speak English either, you know. And so it was a lot, you know, and yet despite everything, she was so very, very, very strong throughout it all, you know, being completely alone. At that time, we ourselves as a hospital didn't have a whole lot of, we didn't have a whole lot of data on transmission. So we were also really limiting our caregivers going in. Both the nurses and the doctors. We would try to complete everything that we could by phone and not really having anyone in her room. We were hearing terrible stories from New York and other places about, you know, so many providers getting COVID. And so she really was really, really, really alone. But we do have a very careful and important discharge planning guide, you know, and every baby has to go home to a safe environment. And so we called her, you know, and got a translator and spoke to her in Spanish about who she wanted to be the one to care for the baby, you know, and without a hesitation, she came up with the name of her sister-in-law and said, you know, my sister-in-law has not been in contact with me. She has not been in contact with the husband. And discharge planning is so difficult for these babies because if you're not going to send the baby home with the mom because she's sick, I mean, the last thing you want to do is send the baby home to another household where there was exposure to the mom. And while they might not be sick now, they're going to be sick in a couple of days, you know? So she was able to identify somebody, and she, you know, said that this sister-in-law will take care of the baby. She's had children before. And so we called the sister-in-law, and she, you know, was just so gracious. She's like, of course, I'll come to the hospital, you know, I'll go through all your screening. I will learn the care of the baby. She'd actually had a baby before, but still it's different with every baby. I'll go through all the discharge stuff and I will care for the baby for 2 weeks, you know, in addition to the children that I'm caring for in my own home already, you know. And so it ended up being a really happy story. The sister-in-law took care of the baby. The mom gradually got better. Her fever got better. She did come off of her oxygen and she did go home. And the dad also got better. You know, he was one of our first cases for our adult hospital as well. And so they really didn't know, I mean, all the protocols. They didn't have the remdesivir and everything. I mean, actually Northwestern was part of the remdesivir trial at that point. So it wasn't something all patients were getting, but he did get better. And he, you know, got off the ventilator and he went home too, you know. So they didn't get to be a family for over 2 weeks. You know, the three of them didn't get to be together. But they are together now. And I think just having a lot of hope and that support, just being able to pick up the phone, call your sister-in-law and just have her say yes. I know this might seem kind of funny to everyone that I'm talking to because I feel like in India, that's just so common. You know, if anybody would say yes. Any one of your 1,000 relatives will say, of course, I will step in and I will take care of your baby. But in the US, that's not as common. There are a lot of people, I mean, I don't think it's because people in the US are bad. I think there's just a lot of people that really do have to go to work every day, or they, you know, barely have what they need to take care of their own children. I think there's a lot of reasons. And I don't think that all of those reasons make the people here worse or better, but I do think that's something India really has going for you, that the social isolation is a lot less just because people are really close to each other. The other thing in the US is, and I think this is a little bit true in India, is that when people move, you know, from one place to another for education or for whatever reason, you may not be as close to your family. So you might not actually have a sister-in-law or a cousin or someone that you can call. And I think that's really hard too. But I think that if I had to give advice to pregnant women, I would be, you know, stay in touch with people by phone, by Zoom, by digital, but also use the time to read books, to, you know, get in a really calm state of mind yourself. As a healthcare professional, I've started meditating, which is something I've never done before. I mean, I've prayed before, but I've never like done mindfulness meditation, but I've started to, and it's been really helpful and beneficial for me. I think, you know, exercising and staying healthy is really, really important. You're going to need that strength for your baby. And then also just identifying support people in the odd event that you do get COVID and you get sick from it. You're going to need somebody to be able to take care of your baby. And that's something that I would really encourage all new families to sort of think about. I don't know that I think that's, you know, the last thing, which I think in India everybody does, is breastfeeding. But here there's a lot of people that don't necessarily, that isn't necessarily their first choice. But if you've had COVID, you know, studies have already shown that secretory IgA and secretory IgG, or secretory IgA, are definitely in the breast milk, and secretory IgG is being studied. And so I think it is very protective. It's protective for virtually everything. So why wouldn't you? But why wouldn't it be protective for coronavirus? So I think I'm going to leave you with those parting thoughts. And thank you so much for having me.
Thank you so much, Dr. Malika Shah. Thank you for sharing all the protocols, precautions taken by the hospital to ease the fears and worries of pregnant mothers. Thank you also for sharing with us the beautiful, inspiring story about how courage and resilience, you know, displayed by the family that you spoke about. I think I would stand by on behalf of all the viewers and listeners today that you have really explained about the risks and challenges faced by pregnant mothers and their families during pandemic. And I'm grateful that you even highlighted the role of the father here. Of course, the isolation measures that are required during pandemic has definitely had an adverse effect on not only the woman, her mental health, but the entire social system, the support that the pregnant mother does require. So thank you for also enlightening us about the role of the healthcare workers and the immense great job that all of you all are doing for the pregnant mothers, giving them the support. I completely understand how difficult it would be for you to take a newborn baby away from the mother, but I guess that is the right thing to do at this moment. So thank you for taking time out of your busy schedule and sharing your views with us. We will take the question answers at the end. Thank you so much once again. I would now like to invite the next speaker, Dr. Sakhi Bhansali, so who would be doing the introduction.
I would request Dr. Manpreet Kaur to introduce Dr. Sakhi Bhansali. Over to
Thank you,
Manpreet.
sir. The final speaker I would request to enlighten us is Dr. Sakhi Bhansali. Dr. Sakhi has studied from Calcutta Medical College, where she was awarded first place in the case presentation competition. She has diagnosed and counseled numerous patients at the Cleveland Clinic in the allergy and immunology department. She has also assisted residents in differential diagnosis and therapeutic management at the University of Alabama. In her latest venture, she has founded a blog called Curious Cranium, which is followed by more than 1,500 medical and non-medical professionals. This blog aims to provide patient and physician education materials and a weekly resource of cases. Dr. Sakhi will talk about how this once-in-a-lifetime experience of being faced with a pandemic will change us for the better and will help us shape our future. I absolutely believe and endorse that it is of utmost importance to look at the bright side even during these hardships that we are faced with. After all, we are all in this together, and in unity lies strength. Welcome, ma'am. Dr. Sakhi, ma'am, on this platform. Welcome, ma'am.
Thank you. Thank you for having me here today. Thank you, Dr. Meghna Basu Thakur, Mukta, and RD National College for giving me this opportunity to share my experiences with you all. Listening to such experienced and accomplished doctors and absolutely beautiful and eye-opening stories, both nationally and internationally, makes someone as young and new as me in this professional field feel it makes me feel a part of something big and great. And I'm here to give you all an insight on how experiences shape the future and strength inspiring the youth from an intern's perspective. There's something that you all should know about me first. I took the Hippocratic Oath fairly recently on the 3rd of March 2020. I'm a young doctor. We pledged the health and well-being of our patients will be our first consideration. On hearing me recite the oath, I remember my father telling me the very obvious. Sakhi, you have big shoes to fill. What wasn't obvious at that time was the most unusual ways in which my ethics, principles, and training were going to be tested in the coming months. I'm going to walk you through my daily duties as an intern in a tertiary government hospital in Kolkata, West Bengal, amidst a pandemic. As interns in my hospital, we spend 1 to 2 months in each department of the hospital learning the basics of each field. We're in charge of measuring the vitals of all our patients in the morning and wait for the grand rounds. Grand rounds are when senior doctors and professors come and monitor the progress of the patients. Grand rounds are integral for us and crucial for our training. It is only then when we get to see and experience professors that have 20 plus years of experience in their training and how beautifully and immaculately they manage patients. So the first hit that the pandemic gave all my co-interns, colleagues, and me also was that professors didn't come to the hospital. They themselves were 60, 65 plus, old, with several comorbidities, and they were scared to enter the wards, and rightfully so. So after the rounds, because of all of this, because the professors not coming, we never really got to work on cool, academic, rare cases. These are the cases that we as medical students hope and yearn we'll see in our internship. Since mine is a teaching hospital, and in medicine, no book can teach you as much as a single patient can, we really hope to see such cases managed by experts from our field. But as the days of my internship started passing, because we were not admitting that many patients, and because professors were not coming, we began to realize that our excitement and our hope was just going down the drains. Moreover, all outpatient and non-emergent procedures were cancelled. What this means is, sadly, only if a patient was critical or actively dying were we meant to admit them. Else, they were just supposed to go home and suffer. This wasn't the administration's fault as well. If any inpatient got affected by COVID-19, our setup was just not capable of handling that kind of chaos. We only had a 20-bed medicine ICU, which was always full. In short, there was no room for a new disease in my hospital. Do no harm, also in the Hippocratic Oath, is the cardinal rule of medicine, and we were strictly asked to abide to it. But the show must go on. Rounds were now given by senior doctors and interns. As interns, we're new, naive, and often confused. It is completely up to us, in my hospital at least, how much we want to be involved in patient care. Unlike the senior doctors, we're not directly accountable for the patient's management. But amidst the pandemic, I think all my colleagues realized that we play a crucial role in their care. Senior doctors and co-interns getting infected with COVID-19 and getting quarantined as a result of that further increased the workload of the working interns. Soon, our seniors started giving us a few patients to be managed by ourselves. Managing patients all on your own as a new intern is a very daunting task in the beginning. But as the days passed, we soon got the hang of it. This kind of exposure of managing patients all on your own wouldn't have been possible under normal circumstances. But these were not normal circumstances, were they? But even though we were getting to do all these new things like managing patients on our own, there were plenty of things that we were missing out on. My colleagues and I often feared, what if we turn out to be bad doctors? Because of lack of exposure or just poor knowledge. But that's when we realized we would just be worrying. And that's when we realized worry is nothing but undernourished enthusiasm. We quickly learned to see the positives. I learned and observed things that I normally wouldn't have. The pandemic taught me a lot about the socio-cultural aspects of medicine. As we rotated through different departments, we began seeing how truly an individual's health is a true reflection of the times that they're living in. What was surprising was the immediate change in the types of cases that we started seeing in several departments. Orthopedics, which would normally see 10 to 15 road traffic accidents per day, now began seeing street violence and domestic abuse cases. Sitting at home, abusing your wife, and picking up fights with your neighbors. What else would you expect the common man who is himself dealing with tons of pressure amidst the pandemic? Social distancing is just a theoretical concept when you have a 15-member family and a one-room house. Fights and arguments are about to take place. So I got to manage several such cases. And honestly, orthopedics never interested some of us. So for those of us, took time to kind of counsel these patients and victims. Empowering them seemed to empower us in the process. But the conditions were tough. I almost found myself losing my resolve. And give me a moment while I share my screen to share a picture with you. That's a picture of us wearing the PPE. This is when the surgery department, surgery posting started, and we were mandated to wear PPEs. Spending 30-hour shifts in synthetic coveralls with triple layer masks and headgears in Kolkata's 40-degree weather, which almost feels like 50 degrees, is not a joke. For women on their periods and for other staff members suffering from migraines and chronic conditions, wearing a PPE is definitely your worst nightmare. But my colleagues and I suffered through debilitating headaches, nausea, but continued to work day in and day out to just do our job. Whenever we would feel low, we would just exit the room and start talking to our patients. Listening to their pains, their concerns, and their worries, we would see our pain blur away in the background. With the Group D staff, the sweepers, patient transport staff, the bhaiyas, the masis, everyone who helps us, the administrative staff, not being there at work because of unavailability of transport, who was to do their work? Well, if we didn't do it, it would only delay the patient's management. My friends and I have pulled and pushed stretchers, changed patient diapers, collected urine samples, and helped patients dress and undress, basically done anything and everything. Anything for the patient we had just pledged. And as a direct reflection of all of this chaos, of this madness, Amphan, the devastating cyclone, hit West Bengal just then. This was during my surgery posting. To give you all an idea of the damage that Amphan had done, I'll just show you a picture. So this is I still remember that day when Amphan happened, the very next day. Uprooted trees had basically blocked all the roads around my building, and I had a 24-hour shift, but I couldn't go to work that day because all the roads were blocked. And this is my hospital during Amphan, which was the cyclone. And I remember feeling rather helpless because I was only thinking about all the broken bones, the lacerated faces, the electrocution injuries, even snake bites because of the flooding, and all those patients who needed all our help, who needed my help, and I couldn't be there. My seniors understood and relieved me from my duty that day. And honestly, I did need a break from all that chaos. Just that afternoon, while I was sleeping, I learned that my colleague had actually walked 4 hours to get to the hospital. And I'll just share that picture with you all as well. Okay, I don't seem to be, okay, there's some technical glitch, so I'm not going to do that. But yeah, so my colleague had actually walked 4 hours to reach the hospital and even helped the cops kind of uproot trees, like just remove the trees from the road. He called me later and he said, Sakhi, duty tha, to jana hi tha. Just when I felt down, when I thought I had done enough and the situation was beyond all our efforts, my fellow co-intern led the way and strengthened my resolve to work harder. When you're put in situations like this, at your precipice, you can either feel helpless and collapse or exercise your grit and power on. I think my colleagues, every single day, I have watched them do exactly the latter. And that's my colleague walking through the floods and reaching the hospital on his duty. So I was looking, we just needed that, and that experience of my colleague basically doing everything he can to go to work, it just made me feel that I need to get back and start working. And we were all looking forward to our general medicine posting next. We love medicine and we planned on being like a sponge, just learning and absorbing everything in the process. But to our dismay, working in the general medicine department during the pandemic was extremely risky. One notable incident that I would like to share with you all happened around in May when the cases were spiking in West Bengal. It was my first week in the general medicine department, and we had just finished rounding on our patient. Our patient, after seeing his chief complaints, his chest x-ray and the vitals, we soon concluded that he was a COVID-19 suspect. He was complaining of fever and shortness of breath as well. Post rounds, my senior asked me to put an NG tube on the patient, which is basically when you put a tube down the nose into the stomach of the patient, just to help them get nutrition. This is normally for people who cannot eat and swallow on their own. Doing this procedure is extremely uncomfortable for the patient. It often makes them cough rather ferociously. Our patient was admitted on the floor, so doing this needed me to sit on the floor. This is all fine under normal circumstances, but amidst a COVID-19 pandemic, doing it on a COVID-19 patient, suspect patient, fully aware that the moment you start the procedure, the patient is going to start coughing and millions of his secretions are going to come latching onto you. Just thinking of this whole episode was rather horrifying for me. And that's exactly when I thought of the Hippocratic Oath again. I will apply for the benefit of the sick all measures that are required. I did the procedure and went back home terrified. But for healthcare workers, the trials don't end in the hospital. I live in a family of 6 with my grandparents and a building of 200 plus people. Just when news of healthcare workers being forbidden to enter their buildings started circulating, the people of my building decided to paint a wall to show their support for my work. And that's a picture of the wall that they painted for me. I would leave the building every morning and come back every night. Looking at that wall just gave me enough, just gave me that push to keep working, to exercise my grit and to keep hustling. So, but that still didn't kind of explain why I should be going back home to my grandparents. Painting that wall did empower me, but I was still scared to come back home. My family members shouldn't pay the price for this, shouldn't pay the price for the risk that my profession entails. They didn't take any Hippocratic oath, I thought to myself. The next thing I know, a neighbor from my building offered his empty apartment for me to live in during my duties in the general medicine department. This felt like divine intervention. After moving out of my house, I immediately started spending a lot more time on the bedside of my patients, trying to work on their cases, figuring out what was wrong with them, unhinged and fearless. I'd like to add here that I was fortunate enough that the situation presented itself to me. For many of my colleagues, living in an empty apartment in the same building, nor is this situation practical and nor is it possible. This just goes to show that even apart from the patients, even the frontline workers are fighting their very own unique battles throughout the pandemic. Luckily, just around the time that I moved out of my house, we started admitting non-emergent cases, which is when we started admitting people and trying to find out what was wrong with them and even doing certain procedures that we were not doing before. So as trains and buses started functioning, people from all over West Bengal started coming. But as unlock commenced, many more people were coming with graver and more serious injuries. All of us interns noticed that. Diseases and illnesses that would normally be managed fairly easily in rural setups as well, they were coming to us at a very terminal stage, often at the point of no return. You may ask why this happened. This is because they did not have any transport or any facilities to reach their nearest doctor or hospital. This is where my co-interns and I realized that we had to practice palliative care. Palliative care is a branch of medicine that maximizes the quality of life of the patient and the family members who are dealing with terminal illnesses. Both the patients and us needed to make the most of the time that there was. We must have succeeded somewhere because I clearly remember a dying woman's daughter came up to us and told us, Allah bhala kare aapka, which in Hindi means, Allah will bless you. Why, you may ask, could she do this? She was happy that in her last moments, her pregnant mother, her dying mother, could actually listen to her holy prayers. We had warned the daughter just the previous night that her mom might not make it till the morning. This is when we realized being a physician doesn't always mean we save lives. Sometimes it can just be about helping their loved ones say a final goodbye. As easy as it sounds right now, it takes a lot to be there and look them in the eye and tell them that it's time. I finished my 4.5 years of MBBS training and 1 year of internship this week. With my internship ending and the pandemic not ending, I don't know what to feel. Everything seems uncertain. I think the only thing that makes me escape what Dr. Shashank Joshi just mentioned before, the sensory overload and the burnout, is remembering my patients' kind words and blessings. They said, "Tomade moto keu nei," which means in Bengali that there is no one like you. And "Tomader jonnoi amra bhalo achi," which means we're all good and healthy because of you all. The more I think, the more I realize that a lot can happen by just taking care of the patient. We can move mountains by just doing our job with honesty and hoping for a better tomorrow. Thank you.
So with your permission, can I propose the vote of thanks to Dr.
Yes,
Sakhi Bhansali?
Yes, please go ahead.
I'm out of words, Dr. Sakhi. I mean, you're nearly 20 years younger to me, and I am so touched with your inspiring sharing. Thank you so much for sharing with us your experience, struggles faced as an intern during this pandemic. I think the way you discussed your responsibilities, your duties as your new intern has not only enhanced, which has got enhanced due to the pandemic, but the overload of patients and the way you all have given the palliative care to all of them. The unforeseen, cyclone that was there in West Bengal, and how at times your spirits were lowered, and how the wall of fame in your building motivated you and uplifted your mood. I think that personal touch was very, very interesting. We are all very inspired by your "we can do" attitude. I think that was really impressive. Your sense of responsibility, kindness, optimism all together. And that's exactly what the topic for our day was. This is called psychological capital, from a very young intern who has just got into the field of MBBS and just getting into the field of being a doctor. Even in the face of such great dangers, difficulties, doctors today, as we call them, the frontline warriors, have actually shown great strength, put their duty in front above everything, their own security, and come in. So I would really extend my gratitude to you and all other healthcare workers, your teams, your friends, for risking your lives to save others. And like very well you said in Bengali, ki tumi shobaide jonne thakur, means you stand as God for your patients. So we truly show your gratitude. And I think I would like to say that healthcare workers are truly the heroes in the hazmat suits. Thank you, Dr. Sakhi. Thank you, Dr. Athavale. I think we can take the questions now. We can take the questions for the speakers now, for the panelists now.
With
your permission,
yes,
sir.
Madam. Please go ahead. Yes. Please go ahead.
So, Dr. Sakhi, there is one question for you. Are we there, Dr. Sakhi?
Yes.
Yes. There is one question for you. That was there a single day that a thought came across your mind that you didn't want to carry on this profession? It's too difficult.
No, I don't think so. I don't think there still hasn't been a single day where I regret being a doctor. I think amidst this pandemic, it is a very negative situation overall, but there are far many more positives to being a healthcare worker. The insight, the depth, just the amount of knowledge and happiness we get dealing with the patients, and knowing that we're making a difference in real time to just the person sitting next to us. I think that beats any kind of satisfaction that I have gotten ever. And yeah, I hope to be like this and help people around me. So no, I never thought that. But yes, there were days when I felt weak. which I clearly mentioned, Amphan, when I couldn't go to work, and I was happy that I have a chutti and I'm not going to work. But the next day I felt guilty and I was like, no, today I'm going to just work extra. So that's important.
Great. So I think the break does it well, because I think otherwise we would reach a burnout. And Dr. Sakhi, there are a lot of people, the participants, who are wishing you and blessing you for the excellent work that you're doing. There is a question for Dr. Shashank. Dr. Shashank, if you're there, Dr. Shashank?
Dr. Shashank sir is there already.
Yes. There's a question for Dr. Shashank. Okay. I'll take the question for Dr. Malika. Are you there, Dr. Malika?
Yeah, she is there. She is there.
Yeah. Can you hear us,
Yes,
Dr.
I'm
Malika?
here. I'm sorry. I just had
Yes.
myself muted.
Yes, there is a question for you that is breastfeeding really a necessity for a pregnant mother tested positive for COVID?
Can you, I'm so sorry, repeat it? My thing was on mute.
Yes, there's a question from one of the participants who says that, is it required, is it necessary for a COVID positive mother to breastfeed a newborn baby? Is it necessary?
Yes. So this is something that's sort of the subject of a lot of controversy, but as of just Thursday, I feel like there's a lot more information. The American Academy of Pediatrics has studied over 1,500 babies and has found that the transmission through the breast milk is extremely unlikely. And even if it happens, it is not dangerous to the baby. So I think I know this is a mental health conference, but we have to just discuss the science of it for just one quick second. So they think, it's postulated, that babies have less angiotensin converting enzyme receptors. And for that reason, when they do get the disease, which has been pretty uncommon, they do tend to have a much milder form of it. So in all these babies that are treated in all these different ways, we haven't had terrible illness. And because there is no cure or vaccine for COVID, if there is any immunity from the breast milk, it will protect the baby. So use of breast milk is really, really, really encouraged. We absolutely want babies to get breast milk. The difficulty is that sometimes moms and babies need to be separated, because if the mom is terribly ill and coughing all the time, we do want to prevent the baby from getting it. So then if they're not together, how do you support breastfeeding? In the US, we do with pumps and hand expression and all these artificial ways. I think that's harder to do in places where pumps are not readily available. So in those situations, I would say if the mom is mildly symptomatic or asymptomatic, doesn't have any symptoms at all, I think it's actually very okay for the mom and the baby to be together, and the mom should wear a mask and use really careful hand hygiene and wash her hands, and actually even wash her breasts. I mean, just wash them before feeding the baby. And that way the baby gets the breast milk, but has mitigated the risk of getting the infection.
Okay. Thank you, Dr. Malika. There's one more question that is coming for you. In spite of so many precautions that are being taken, has it happened that a baby has been infected with COVID in the hospital, either from the mother or from any other patients or health workers around?
It has been reported. We haven't had one at our hospital, really. We had one case where it was positive, but then we did two additional tests and they were both negative. But the baby was absolutely fine. We didn't have any illness on the part of the baby. But the New England Journal of Medicine reported a 21-day-old in Texas who was admitted, who was terribly ill, required, ventilator, oxygen, chest tubes, the whole thing. So it has absolutely been reported. So I think, again, it is the most important thing to use the very simple techniques of washing your hands and wearing a mask. And I think that when you do that, you mitigate the risks. You can't mitigate them completely, though. It has been reported, but it's been rare. It's been quite rare.
Okay, thank you once again, Dr. Malika. There's the last question for you. That what has been the father's role with COVID positive mothers, just delivered mothers in the hospital in US? What has been the father's role?
So I'm really pleased to say that for the COVID positive mothers, we don't allow any person in the room. So that means not the father either, because if the father is positive, we don't want two positive people in the hospital. And if he's negative, we don't want him to get it from the mother. That's just our policy. So at the end of the day, the mom delivers alone. Because we have been requiring a healthy caregiver for the baby, very often that ends up being the father. We are really lucky to be able to get the fathers tested. And in many, many, many situations, we have had the father actually be negative, and we have discharged the baby to the father. And they have been amazing. When you talk about resilience, I mean, I think it's really common to think about men and war and women and household things, but these are men in the family, and they have been stepping up. And, you know, they have been, honestly, quite frankly, there have been mothers that have been sick that have had to stay in the hospital longer because they're sick and on oxygen. And, you know, the US is so specific because of insurance and things like that, because if the baby is healthy, they will be discharged. It doesn't matter if the mom is in the hospital or what is going on. You know, the baby's length of stay is very dictated by these sort of guidelines, and they're supposed to go home at a certain period of time. And so we will send that baby home with the father. And, you know, not every father is fully capable of that. The other thing that I can't even emphasize enough is, you know, not every time is at the first delivery, right? You could have children at home. And, you know, pre-pandemic, you would call your mother, your sister, your babysitter, your neighbor, whatever. You know, right now, nobody really wants to come over. Everyone is locked down. Everyone is in their own house, you know, taking care of their own health and their own family. So it's the fathers that are taking care of these other children that are 3 and 5 and at home, and also in need of care because their mother is gone. So I've been really impressed, and I've been impressed by my own husband and him, you know, his ability to take care of my kids when I have to go to work, because we don't have the same access to babysitters and things like that. So it's been, I think that's a great question. And I think it's actually been, I mean, I won't say good for fathers, but I think fathers have really stepped up, and I think that's been really great.
Thank you so much, Dr. Malika. I think that was a great input for fathers. There's a question for Dr. Sakhi. Are you there, Dr. Sakhi?
Yes, I'm right.
So, Dr. Sakhi, there's a question from one of the participants who says that why do doctors and health professionals get COVID positive infected in spite of taking precautions, and they know the medical field the best, and yet they have been infected? So can you highlight a little bit on that?
So firstly, yes, taking precautions is very important, and it does prevent many of us from getting the diseases, but getting this disease, but no precaution is 100% effective. And there is no way that you can say for sure that 100% of the times you have saved yourself. I mean, there could be a patient, and especially in the hospital, especially in a government hospital like mine, where there is no social distancing even amongst the patients. Forget the healthcare workers. It's extremely risky and very, very easy to get the infection. And I think we have to be right every single time, wearing the mask, washing my hands every 10 minutes, wearing spectacles, wearing eye goggles. I mean, I've had colleagues do all of that and still get infected because the virus is extremely small. I think 0.05 microns, if I'm not wrong. And that can percolate through anything if you're not 100% careful all the time. So yeah, that's the answer.
Great. Thank you, Sakhi. There's one more question which says that if you have seen distressing patients, which you would have seen, and COVID death, how do you and how have you personally coped with the situation and gone back to work the next day?
Yes. So seeing distressing patients does become the new normal, especially when you're working in a government hospital again, because sadly in India, money does play a very important role in getting good quality healthcare. So we are almost used to it, but yes, it is very distressing, especially because in a pandemic, it's much, much more. I think with every loss of life that we see, we also get to see 50 other patients that we're actually helping. And whenever we feel that we are weak and we're not being able to help others, we just look at the other 50 smiling faces who are grateful for our knowledge and our training and our professors' knowledge and training. So that kind of makes you just work harder and be like, the next time I want to even try and save that one single patient, go home, read more, and come back with a smiling face the next day. So.
Thank you so much, Dr. Sakhi. I think we've taken all the questions for the evening today. I would like to propose a vote of thanks to all the doctors, starting with Dr. Shashank Joshi. Thank you, sir, so much for enlightening us about the unpredictability, vulnerability of this catastrophic pandemic that has hit the entire world. You were absolutely right about the virus in mind causing us not only trouble, but the extreme anxiety that all of us are. And actually for de-stigmatizing, the fear that we all have that I just may be infected. You were also very right in identifying the information of being overloaded, and this is basically called the infobesity. We have so many WhatsApp groups, so many newspapers, and so much of information coming in that I think we've reached a point that we are not able to assess which is the correct information, and that increases the anxiety in us. I think your advice to us is very, very right, that we need to kind of detoxify ourselves from the net for 2 hours a day. I think it's important to live a healthy life, whichever medical, methods we follow, whether that's Ayurveda, homeopathy, but we need to be happy. We need to have a good, optimistic thought. And I think we look up to you for the kind of psychological resilience that you've been showing. We are really grateful to you to take out time from your busy schedule, and thank you for all your practical suggestions. Thank you so much for spending the evening with us and enlightening us on these practical tips. I would also like to extend my gratitude to Dr. Avinash D'Souza for sharing your experience and enlightening us about the importance of mental health, especially during these trying times. Sorry, sir, had a little bit of an internet issue, but I think we got the main points from his initial discussion. He did discuss how the pandemic has exposed us to so many negative emotions. The death has caused grieving in the family. He has raised awareness also about the neglect and stigma faced by us and the healthcare workers. Thank you so much, sir, for enlightening us on that. A very, very warm thank you to Dr. Malika Shah for taking time out of your busy schedule on a Sunday, 7:30 in the morning. And I have been very hyper and waking you up at 5 o'clock in the morning, but thank you so much for being there. I think this whole topic of motherhood, fatherhood, neonatal, and newborn babies, I think it was very untapped, because we've been reading a lot about the geriatric population, the people with comorbidities, but really not too many people are talking about pregnant mothers. And the reason why I was really interested, because I know of a friend who recently had to deliver, and she did not want to go to a hospital to deliver the kid, and she wanted to opt for home delivery, where her case was a cesarean case. So I understand the fear that she had, that what if I got infected? What if the child was born and it got infected? So, understanding her state of mind, I think it was really interesting. Your insights were really useful. Thank you so much, Dr. Malika Shah. And I think Dr. Sakhi Bhansali, you have won the heart of all participants. I think your personal touch, your young being, and your experiences have really, I'm here, I see loads of messages, of course, for all the speakers, but everyone is touched by your humane side. So thank you so much for sharing, and everyone wishes you a real good path, and blesses you with you to continue with your humane side, your kindness, and I'm sure you'll be a very good doctor, and maybe we'll come one day to you for treatment.
Thank you so much.
All the panelists. This program would absolutely not have been possible without the aegis of Mukta. So I really want to extend my warm welcome, my gratitude, gratitude to Professor Subhash Athavale sir, Professor Nadwadi, and the entire team. Everyone is busy, and I know sir is in midst of so many meetings, but promptly sending out the links, promptly arranging this entire streaming, having all other members spend time with our college program, and encouraging us to do so many more such programs. I really am obliged, sir. Thank you so much, Athavale sir. Thank you, Manpreet ma'am. Thank you, Megha Somani ma'am. Thank you all Mukta members for encouraging me to go ahead with this program today. It would not have been possible. This is a huge platform for me, and thank you for allowing me this platform. Thank you, sir.
Thank you very much, Meghna, madam. I would just take a minute. Like all the resource persons, they have given the real insight. And really, Sakhi, madam, you have given the insight that how the doctors should be and what is their role. Even Shashank sir, he had spoke about the retina problems which are going to occur to the children. And I think one of the resource person in our one of the programs, she has talked about a more dangerous virus. She has described it as a more dangerous virus, that is TBT. I was thinking, what is this TBT? Corona and everything, we are all aware. But she has described it as two blue ticks. When you get these two blue ticks, you get your mind full that, yes, my friend is looking after, and he's, really enjoying what post you are sharing. So these blue ticks are also converting into a virus. And I think rightly said by Dr. Shashank that there may be retina problems because of this over or more use of all these digital gadgets. So thank you very much, all the panelists. Thank you, Malika madam, for taking out your time early morning. And really, Meghna madam was discussing with me that it's very early for her to join, but still you could make it. Really, thank you very much for making it up and giving lots of insights, and a lot of initiative has been taken from all of you. Thank you very much.
I just extend my thanks to Malika Shah ma'am from Chicago. And we remember Chicago due to the Swami Vivekananda. And that I really feel happy to see you from the Chicago. Thank you. Thank you very much.
Thank you so much. Thank you to all the panelists members.
We'll stop live streaming.
Thank you.
We'll stop live streaming first, and then if it's all any discussion, we can do.
Yes, sir. Yes, sir.
Could you please? Yeah. Live streaming.